We'll go into the next one. So whenever we talk about patients come in and they say, somebody told me I have to have a joint replacement. I always laugh at this.
I get that all the time.
I was like, what does that even mean? You have to have a joint replacement.
Too,
this doesn't make sense. Tell me your answer to patients whenever they come in. They say, oh, somebody saw my X-ray of my knee or my hip or whatever, and I have to have it replaced.
Well, you know, my answer or response to it isn't actually an answer. I'll review immediately what they have and have not done. I would, you know, the vast majority have come in. They've had a little bit of treatment, maybe an injection, but a lot of them haven't failed, you know, conservative treatment, rehab, maybe bracing, depending on the arthritis.
Sure.
Not only steroid or cortisone injection, steroid and cortisone being the same thing, or we mean the same thing, but injection with Visco, which is the gel injections,
of course,
that a lot of people know as rooster comb injections.
Yeah.
You know, there's even injections depending on the patient now with biologics, and their own platelets and plasma, their own PRP. So I'll usually go through, make sure, not that they failed everything, but I think if you've tried a good couple of things, you're not making you're not getting them any more comfortable.
Yeah.
I think it's time to move on. If they come in, there's an obvious deformity on their knee because they are so worn out, so to speak. That's when I do talk to them about conservative measures, but I'll tend to refer much more quickly to somebody like you,
right,
to somebody that replaces a joint, because sometimes there's so much deformity. You want to do the replacement if indicated, just so they don't have continued problems and you don't make the outcome that much worse.
Well, and I tell patients, the mantra that I have is, you don't walk on X-rays, I don't operate on X-rays. I operate on patients with knee pain. And that's where, and I sound like a broken record to patients a lot of times because it's all about quality of life. It's like there are risks to what we do, and don't get me wrong, I love to operate. I could live in the operating room and be a happy man. But that being said, there's no benefit to me jumping in and operating on a patient who has not tried conservative things, because we've all seen it. We have patients that have horrible X-rays, and you look at it, and I'm anticipating walking into a room with a patient in a wheelchair, and they're still, you know, getting in and out of deer blinds, they're loading up corn feeders, or they're, you know, going on walks and going on hiking trails, or, you know,
some of them still run a few days a week and so forth, right?
And they're just like, well, I've got a little bit of soreness here. That's not a patient I'm going to run off to the operating room, because it's not necessary. Something like a fluid flow shot or an amnio shot or PRP or Visco, we've got so many options nowadays. And no, none of them are a magic bullet. If you watch, you know, infomercials and they show an X-ray and magically it reverses time, I'm sorry, that's Photoshop. It's not real. It's not going to happen. But they can work incredibly well. And I mean, I've seen patients of yours that you've been following for years with just the occasional injection. I look at the X-ray and I'm like, is that patient still walking? And you're like, oh yeah, they just got back from a trip to Europe.
It's amazing that some of them with the biggest deformity will go 2 years, 3 years, 4 years, much better than expected.
Yeah.
With conservative treatment, maybe one of the injections I discussed and so forth. So.
Yeah.
No, but I'm the same way. I was taught a long time ago, you don't treat images, you treat patients.
Exactly.
And we follow it, and we try to be honest and honor, you know, what they want. I frequently find myself telling patients, especially if they've gone a while, they want to know, how do their X-rays look? And I always tell them, it doesn't look any worse. A lot of them are disappointed it doesn't look better.
Yeah.
But my educational part with them is, I just don't want it to look worse. As long as you're functioning, we'll keep an eye on it. Yeah. Even if we have to X-ray you every 6 months or every year, we'll keep an eye on it. And then when you really start having trouble, that's when we revisit. Yeah. Hey, is it worthwhile looking at replacement again?
Well, and that's where I think the sports medicine model has worked so well, in that as you don't operate, but I do, it gives us a natural transition where patients can make sure they've really tried all the easy things. Because the very last thing you're going to do is have a surgery too soon, but at the same time, you don't want to put off surgery so long that now you've given up all the things you enjoy. Patients don't realize that even with the knee replacement, you can still be incredibly active. Like I've got folks that play high-level racquetball, tennis, they still ski, they still do some jogging, they're in the gym. It doesn't mean
they definitely still fish and hunt.
Absolutely.
I sent a lot to you just so they can continue fishing.
That's like the one question I have to be like, all right, doc, this is when deer season is.
Yeah, I need to be better by deer season.
I can do it out of my low blind, but I want to be in this high blind over here. You've got to make sure I can get out of a ladder. It's like, all right, we've got a plan. So, I mean, with partial knee replacements, total knee replacements, different types of hips, new approaches, minimally invasive, all these things have revolutionized. But if you have not tried the simple things like the injections, bracing therapy, I would not recommend jumping into something as big of a replacement, because once you do it, we can't go backwards.
Good advice.
No worries.
Good advice. That'll work.
This has been fun. Hopefully
I
we
think
can
that's
keep
why
this
I like
up.
working with you.
I know. It's a good time, brother. We're going to try to make this a regular thing where Tim and I sit down and we just kind of pick out topics. We would love for y'all to send comments with common questions you've had. Maybe you're scared to ask them, or maybe you've gotten different opinions and they're conflicting. Keep in mind, these are our opinions. Just because we say it, we don't pretend it's the gospel. But hopefully, coming from two active physicians in the community, we can give you some insight into what we think and how we look at things, and we'll try to keep this going for you. But thanks a lot for listening. We appreciate it.
It's been a lot of fun.